Through my organization at Team Aesthetics, we're going to be offering several different educational products. What I'm excited about is our new video on demand product. This will be available in technique modules for any of the different materials that I work with, as well as a comprehensive overview of clinical cases that various doctors that I work with will be filming the clinical aspect, and we'll be taking the laboratory phase all the way through in a comprehensive start to finish presentation. This should be a very exciting way of viewing dental education. Other phases that I'm excited about within Team Aesthetics are that we're partnering with the Pankey Institute to again provide live patient treatment programs. Each doctor will bring a patient to the Pankey Institute in Key Biscayne, Florida, where he will treat that patient for an anterior cosmetic case under the supervision of the Pankey Aesthetic teaching team. This includes people like Dr. Jerry Sheesh, Dr. Tom Trickner, and many, many other very talented people that will be part of that team. These people will also be providing content on our Team Aesthetics site of their favorite techniques in the video on demand format. So that's very exciting as well. The new program that we're involved with the Pankey Institute involves the development of a Pankey Aesthetic program. For the last year, we've been teaching courses on aesthetics at Pankey, and we're very excited to announce in the beginning of 2010 we will be offering live patient treatment courses. The Pankey Institute has received licensure as part of a dental school campus where dentists from all over the country can bring a patient and we can actually do clinical procedures there, working on aesthetic veneer cases with a focus on functionality, and treat the patient in the facility under the supervision of the Pankey instructors. This is a very exciting form of learning. We will also be offering to pair dental technicians with doctors treating patients, so we have a comprehensive treatment team as an outcome of this entire process. The Prerequisite Aesthetics 1 courses are going on this year already. If you're interested in this process, I would encourage you to contact the Pankey Institute and sign up for these as soon as possible because the spaces are running out. I will also be running prerequisite education for technicians through our Team Aesthetics program here, both as a video on demand format, and we'll be doing a few hands-on courses that will give very comprehensive one-on-one training here in our facility. So all very exciting events, and we look forward to seeing you involved with them. What's going to be really cool about this program is that we're going to develop content based on technique. We'll do modular instruction of different phases of the laboratory process as well as the dental process. Each of those modules will be available for viewing from our website at teamaesthetics.com. You can click on there and on a pay-for-view basis view the entire EMAX technique video on our site. We will also cover full technique of waxing, upper and lower restorations, functionality in wax, how to inject restorations in wax. We will cover incisal techniques where we create some very nice incisal translucency patterns. We'll look at surface morphology as well and look at the different shapes that look good both in the laboratory and ultimately we want to see what's going to look good in the mouth. We'll also have the opportunity to explore different types of restorative materials from zirconia to refractory-based restorations. We'll get into a little bit on posterior restorations, and we'll be doing some very innovative work with implant aesthetics. Overall durability and resistance to chipping is making us very excited about the EMAX lithium disilicate posterior restorations. One of the things that's going to be very interesting about the way that we're teaching is the equipment that we're using to film our videos with. Here I have a global microscope, which is a beautiful tool to work in. As I've gotten older and my eyesight has developed the need for glasses, I found it's been much more convenient to work through a surgical scope of the quality of a global, and it's very helpful to the quality of my work to do this. As a teaching tool, the real advantage of this is that you, as a participant, get to see things from exactly the same angle that I do. We have a very high resolution camera that's mounted directly into the scope, so as I look through the scope, you get to see things from exactly the same angle that I'm looking at them. So as I perform a build-up or contour a case or work on a wax-up, you'll see the same silhouette shapes and see exactly what I'm doing. So it should be very educational content, and I'm very excited about that portion. One of the things that this type of technology allows me to do is share with you my day-to-day work. As I'm working on a case, it's very easy for me to pick up my global scope, look through it, and go to my computer and directly import what I'm doing into iVideo. From there, the material comes straight to you. For example, to give you a quick example of what this will look like, I've just grabbed a case that's on my schedule today. This happens to be an Emax case that has implants underneath of it. We're working with a combination of zirconia and lithium disilicate to create some nice aesthetics for this patient. But take a peek at what you'll see in a teaching video as we start working together, and you get to see what I'm looking at. Right now I'm recording this directly into my computer, and I'll put it to where you can see it as well in just a moment. But from a teaching standpoint, we can start going through this and looking exactly how I might build a case up. Okay. In working with Emax, low translucency, I'll do a full facial cutback, and then I'll start building my incisal effects and controlling my color. In this case, we've already gone through the staining phase, and you can view the entire Emax technique video on our site. This is just to serve as an example of what quality of filming you're going to see and quality of education. Here I'm setting up some of my blue-white incisals. For my incisal effect, I may use a little bit of incisal number 1 here adjacent to that. And I may come back with a little bit of blue interproximal and fill in there. I can then come across and continue adding lobes to help develop the type of effects that I would like to see. As I go ahead and finish this build-up, we'll go through the effects with mamelons and all of the different components that we use to try to create the aesthetics that we would like to see in the final case. This is just a quick example of what the view is like through the global scope. Incidentally, this type of a microscope is wonderful in laboratory for teaching your other technicians and for quality control. I also have the scope hooked to a 50-inch plasma screen in my room, and when a ceramist brings a case in that I would like to show them something about, I'll look through the scope and point to contours that I may want to change, an embrasure that's not quite right here that I'd like to see opened, and then they can watch me actually open that. So the idea for this type of education actually was generated internally here, just interacting with my ceramist, and my thought is that if it's great for them to learn this way, it may be great for everyone else in the field to learn this way as well. So hopefully we can share ideas, and this should be a fun experience.